Bendamustine Hcl Vial is a medication used to treat certain types of cancer, such as lymphoma and chronic lymphocytic leukemia, CLL. It belongs to a class of cancer chemotherapy drugs known as alkylating agents, and it works by killing cancer cells or slowing their growth. It is important to follow your doctor's instructions and the dosage prescribed. The optimal timing for taking this medication will depend on your specific treatment plan, so be sure to consult with your healthcare provider. Bendamustine Hcl Vial can provide benefits in managing and treating certain types of cancer, but it is important to discuss any concerns with your doctor. This medication is given slowly into a vein by a healthcare professional as directed by your doctor. The dosage is determined by your medical condition, body size, and how you respond to treatment. Before each cycle, you will need blood tests to determine the best dose for you and see if you need to wait before receiving this drug again. This medication may cause infusion reactions such as fever and chills. Your doctor may instruct you to take a fever reducer, an antihistamine, and a corticosteroid before receiving this medication to help prevent these side effects. Make sure to use these additional medications exactly as directed by your doctor. If the medication leaks out of the vein into the surrounding area, it can cause serious skin and tissue damage. If you experience pain, irritation, redness, or swelling at the injection site, notify your healthcare professional right away. Prompt treatment of the leakage will help reduce discomfort and possible skin damage. If you're using Bendamustine Hcl Vial, you may experience side effects such as nausea, vomiting, diarrhea, tiredness, headache, dizziness, weakness, or mouth sores. Serious side effects may also occur, but your doctor has prescribed this medication because they believe the benefits outweigh the risks. Be sure to report any serious side effects to your doctor, including unusual tiredness, pale skin, easy bruising or bleeding, and signs of liver disease. It's important to note that this medication may lower your ability to fight infections, so be on the lookout for any signs of infection and seek medical help right away. Additionally, bendamustine may cause side effects due to the rapid destruction of cancer cells, so be sure to talk to your doctor about any symptoms you may experience. This medication may also increase your risk of getting a rare but serious brain infection, so be vigilant for any symptoms and seek medical help if needed. Lastly, if you notice any rash or symptoms of a serious allergic reaction, it's important to seek medical help right away. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before starting bendamustine, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have any blood or bone marrow disorders, kidney problems, liver problems, or recent/current infections. Bendamustine can increase your risk of getting infections or make current infections worse. Be cautious around people with easily spread infections, and talk to your doctor if you have been exposed to an infection. It's also important to let your healthcare professional know if you are using bendamustine before receiving any immunizations or vaccinations. Avoid contact with people who have recently received live vaccines. To lower the chance of getting injured, be careful with sharp objects and avoid contact sports. This medication may also make you feel dizzy or tired, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you can do so safely, and limit alcoholic beverages. Talk to your doctor if you are using marijuana. Bendamustine can affect fertility in males, so it's important to discuss this with your doctor. If you are pregnant or planning to become pregnant, it's crucial to use reliable forms of birth control during treatment and for some time after the last dose. This medication may harm an unborn baby, so a pregnancy test should be ordered before starting this medication. If you or your partner becomes pregnant, talk to your doctor right away about the risks and benefits of this medication. It is unknown if this drug passes into breast milk, so it is not recommended to breastfeed while using this drug and for 1 week after stopping treatment. It's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Bendamustine Hcl Vial, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Bendamustine HCl Vial include idelalisib, and other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Always consult with your healthcare provider before taking any new medications or changing your current regimen. The benefits of Bendamustine HCl Vial include its effectiveness in treating certain types of cancer, such as chronic lymphocytic leukemia and non-Hodgkin's lymphoma. The dosage and timing of this medication will vary depending on your specific condition and medical history. Be sure to follow your doctor's instructions carefully and ask any questions you may have about the best time to take this medication. If someone has taken too much Bendamustine HCl Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, you can contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. Symptoms of overdose may include a fast or irregular heartbeat and fainting. Make sure to schedule regular lab and medical tests while using Bendamustine HCl Vial, such as complete blood count, liver and kidney function tests, and skin exams. It's important to keep all medical and lab appointments and consult your doctor for more details. Bendamustine HCl Vial is used to treat certain types of cancer, such as chronic lymphocytic leukemia, non-Hodgkin's lymphoma. It works by slowing or stopping the growth of cancer cells. The dosage is based on your medical condition, body size, and response to treatment. This medication is given by injection into a vein by a healthcare professional. It is usually given on days 1 and 2 of a treatment cycle. The treatment cycle is repeated every 21 to 28 days. Be sure to follow your doctor's instructions carefully. Make sure to take Bendamustine HCl Vial as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication, Bendamustine HCl Vial, is typically administered in a clinical setting and should not be kept at home. It is used to treat certain types of cancer, such as chronic lymphocytic leukemia and non-Hodgkin's lymphoma. The dosage and timing of administration will be determined by your healthcare provider based on your specific condition and medical history. Be sure to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.